When evaluating a patient with hip pain, the crucial first step is to differentiate whether the patient is describing radiating low back pain, sacroiliac joint pain, trochanteric pain, or true hip joint pain. The first thing you should do when a patient complains that their hip hurts is have the patient show you where the pain is. Most patients will point to the pelvic rim, which automatically tells you that the pain is most likely radiating from their lumbar spine. Patients may also point to their lateral hip, which often indicates trochanteric bursitis. The true hip joint is in the groin. Examination of the hip usually does not progress linearly from inspection to palpation to range of motion.
The hip joint is deep enough to preclude appreciation of effusions on physical examination. Observing the patient's gait is helpful to direct your physical exam, as patients with antalgic gait have shortened duration of stance on the painful side. In addition, in disorders of the hip, the patient tends to center weight over the affected hip, which minimizes the force transmitted through the hip.
Most information about the hip joint is obtained through a combination of gait analysis, palpation, range of motion assessments, and provocative testing. The hip joint is a ball and socket joint that articulates the acetabulum of the pelvis, which is the socket, with the femoral head, which is the ball. This is a very stable joint that has a wide range of motion. There are many supporting structures, including ligaments and several muscles, which provide stability to this joint.
With the patient seated, palpate the sacroiliac joints by applying pressure right over the joints. The Faber maneuver, which is flexion, abduction, and external rotation, also applies pressure to the sacroiliac joints and may indicate SI joint pathology. Palpation can highlight areas of tenderness. The most common area of tenderness is over the greater trochanter, which is most easily felt with the patient supine. Tenderness here can indicate trochanteric bursitis. To perform range of motion on a seated patient, start by asking the patient to bring the knee to the chest. Normal flexion of the hip is up to 120 degrees. Internal and external rotation can be performed with the patient seated. Stabilize the thigh with one hand, and with the other hand, move the heel centrally, then laterally. Central movement of the heel produces external rotation of the hip. Normal hip external rotation is 45 degrees, and internal rotation is also 45 degrees. To perform this exam with the patient supine, first test hip flexion. Test internal and external rotation by holding the hip and knee flexed to 90 degrees. Place one hand on the knee and cup the heel with the opposite hand. Gently rotate the leg internally and externally.